Deb Leitner. I'm a urologist here at Mayo Clinic in Rochester, and I had the privilege of being the medical director of the Office of Staff Services for 12 years. The office started first in 2002. I was sat on the panel along with Bill Brown, my partner here, and then became medical director, stepping down last year.
I'm Bill Brown. I'm the chair of the Office of Staff Services. I have been in the office since 1986 and was instrumental in trying to start the program that we're going to be talking about today. The title of that article that we did with respect to the program is An Organizational Model to Assist Individual Physicians, Scientists, and Senior Healthcare Administrators with Personal and Professional Needs.
We should probably tell you a little bit first about the Office of Staff Services. What Bill's referring to is that the office, when it at its inception, predominantly did financial services for the voting consulting staff. And in 2002, thanks to Bill's advocacy,
Yes.
the Board of Governors here approved the development of the Office of Staff Services to have an additional arm which would allow resources and referral for people who had concerns, either family or the voting consulting staff themselves, and could bring them to a panel, a representational panel within the offices. It was specifically located within the Office of Staff Services that provided financial support so that it wouldn't be a barrier for people coming in to see us.
When we started this program, we felt that it was important for the medical staff, the scientists, and the administrators to have a resource for an employee assistance program that would assist them with their personal and professional needs, the crises that erupt in their days outside of the workplace, or even those that do come from the workplace. The financial planning aspect of the office had started in 1968, so we were very well versed in dealing with medical staff needs from a benefits perspective, pension, and other institutional needs. But the requirement to try and deal with the personal needs was becoming more evident, and we decided to try and promote that process.
Yes, and the office has been very busy, seeing somewhere face-to-face between 5 to 7% of the staff each year. So a very busy group.
Right.
The paper that we're referring to actually takes the work that we have been doing for quite some time, which we know is reactive. So most of the people who are coming to us already have difficulties in their personal and their professional lives. And so the concern was whether or not we could do something more proactive on a one-on-one basis. And so we were able to use the staff of the financial planners within the Office of Staff Services as a way to screen. This was started as a pilot project.
And in the process of building the pilot process, what we wanted the planners to do was to expand the role that they played and become more of a resource for referring to our panel members, the physician panel members that we have on staff, to consult with staff prior to the crisis situation, potentially try to circumvent some of the crises and become more proactive in dealing with day-to-day individual or work issues. So what we did was we spent time training our planners to mail out a questionnaire before the first interview or the initial interview, asking what kinds of things the staff would like to talk about. So more than just the financial planning types of questions, we expanded it to incorporate daily life issues, work-life balance, well-being, health issues, interrelationships in the office or workplace, advancement through academic rank.
Mm-hmm.
And then we spent a lot of time training the planners on where those resources were, who the resources were within the institution and outside of the institution, so that they felt comfortable answering initially and then providing more feedback on a resource and referral basis.
And they're becoming much more comfortable with that role as well. Bill has done this for a long time. It's just part of who you are, to reach out beyond the financial planning, and I think now the financial planners feel much more comfortable fielding those questions as well.
And we discovered that in the role of a financial planning person, you start to find out a lot about people's individual lives. When you know their benefits, when you know about their financial situations, you get involved in divorce situations, you understand and get involved in much of the personal, financial, and family information, and that allowed them to just extrapolate upon that to advance this new protocol. All of the interviews or all the meetings within the office are confidential. It does not become part of the medical record. We have a psychologist and a psychiatrist that we buy from the Department of Psychiatry in terms of time, and they're available for crisis situations. That's been extremely helpful. And then they do a resource referral. So it is it's a functional EAP service, thus not having the information discoverable or part of the medical record. That anonymity is really important to the medical staff, and it gives them more comfort in discussing and providing the information that we've not had prior to that.
Overwhelmingly, people won't come forward unless it's confidential, knowing that we're going to be a listening ear and provide them the resources and the support that they need.
I think one of the major things that we would find from this is that the medical staff are more willing to talk to colleagues
Absolutely.
than they may be to an outside person that they know nothing about.
Absolutely.
And they trust their colleagues' referrals to outside counselors, outside professionals when they need help, because they feel that somehow that's been vetted through that professional that's a colleague. That's been an extremely valuable resource for us. And the volunteerism from our staff, since none of these positions are paid, is wonderful for us to have our medical colleagues volunteer their time to meet with other colleagues in our office. The anonymity that the office brings is huge.
Mm-hmm.
You could be sitting in our waiting area and they'll think, most everyone will think you're there for financial planning, because 75% of the staff is touched each year in some form or fashion with tax preparation, financial planning, benefits questions, enrollment in benefits. So when you're there, there's no one knows why you're visiting. So we can have, that gives a comfort level to those folks who are in crisis to come and sit and wait for us.
And I think it was a brilliant idea of Tate Shanafeld's to bring forward this pilot project, because if a colleague is already sitting down with the financial planner as just as routine, then it's very seamless for the financial planner to then ask specific questions. How are you doing? About other. There are very few institutions that are offering this. We're also very unique in the financial planning piece. It's
Correct.
very unusual for a major academic institution to have financial planning, to allow its physicians and scientists the comfort with financial planning to be able to concentrate on your work. I think that's critical in this.
Right. Financial planning's been around for almost 50 years,
Mm-hmm.
but it is unique to Mayo.
Yes.
I have not found other financial planning programs at other institutions. The new program, the well-being program, would potentially be available at other sites, but in a different manner. We think that the combination with the financial planning is making a huge difference.
Yes. You could have this sort of a wellness program for other academic institutions. I don't think that's a problem. We already had a culture where you knew that you could come to the Office of Staff Services and discuss your financial needs, your college planning, your retirements, your investments. All of those things were available to you, and you already knew that it was a confidential service that we were providing to you. So then by extension, to look at other issues of concern in your personal and professional life, there was the understanding that that was also going to be a confidential service. That would be much more difficult to do someplace else. You're coming into a panel that's been approved by the board. How do I know that when I talk to you about difficulties within my personal and professional life, that's not going to immediately go back to HR? Mm-hmm. To build up that kind of trust would be a long reach. Whereas here, we already have the culture. We already have the established supports within financial planning to just extend it to this piece. And I think I say this quite frequently, we've saved careers in the Office of Staff Services.
Well, thank you. We hope you do enjoy the article. We think the article will be helpful in understanding a dynamic of how to assist your staff in both their financial and their family and well-being situations.
Yes, indeed. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.